I have been a speech pathologist for about 20 years, over 20 years. Just to explain the field that I'm in, I am a speech pathologist within the medical aspect of speech pathology. A lot of people are familiar with speech pathology in the schools, working with children, but I deal just on the medical side. And within that medical aspect, I just deal with voice and swallowing. So it's a bit of a niche. I also have a music background and I have a second degree in psychology. So all of those things really help me to interact with my patients better. So the main communication disorder I see is actually hoarseness. That's what people come to me for very often, and it's it sounds like something that we just would take for granted. Everyone's been hoarse at some point in their life when they've been sick. But the reality is that there are people out there who are chronically hoarse, or their voice will get better, say a teacher, voice will get better, and then it gets worse and better and worse. And this really takes a toll on your ability to communicate, because communication is not just about the words, it's also about the way in which you say it. And the voice carries a lot of emotion. And if you're not able to communicate properly via your voice, you're not doing yourself justice in the sense of communication. I don't think it gets enough notice because of the fact that many people have been hoarse. So it seems like we don't have enough patience with others who have hoarseness, and we tend to brush it off as just something that happens. But the reality is that hoarseness is really something that should be addressed and can be treated. Communication is special to humans, right? I mean, this is what makes us different from other animals, is that we have this ability to connect with people. And when we're not able to communicate fully, that connection is really lost. And like I was expanding on before, the voice carries a lot of emotion in it and with it, and there's a lot of connection. I mean, just how you would talk on the phone with someone you know, and you can immediately tell that that person is sad or happy. And so that communication information is extremely important in relaying who we are, our identities. And when that's broken, that's a major problem. And it's great that we have this field of speech pathology that can address that. What I do in my field is, again, attending to the voice box. Now, the voice box, of course, has the vocal cords within it. When you cough, the vocal cords are actually what's making that sound. The vocal cords are slamming together. So cough then becomes part of my field. We can train the vocal cords to do different things with the voice. We can also train them to respond to us in terms of cough suppression. We also deal within the field of voice pathology with a lot of breathing issues. And breathing is very much, of course, tied into the cough. So seeing patients with chronic cough and breathing issues is within my scope, and it's very satisfying to have someone come in and within about 2 sessions, sometimes three, somebody's chronic cough that they've had for 10 years can actually be attenuated. I think the main takeaway is the fact that voice pathologists are out there. A lot of people who have hoarseness just don't know what to do, who to turn to, and if their problem can ever be solved. And so I want people to know that there are people like us out there to help you, and that you shouldn't suffer. You shouldn't go on not being able to communicate and not feel like yourself, and that you've lost part of yourself if you've had chronic hoarseness.